Good afternoon and welcome to Community Paramedicine. Today we are going to be talking a little bit about our role in public health and our partners in public health. So, in Western North Carolina, EMS faces challenges that go far beyond one-time emergencies. We see the same patients over and over and over again. Those with overdoses, our chronic illness patients, or mental health needs. The Community Paramedic Program allows us to step into a public health role, bridging emergency response with long-term care. Our work is not about taking over doctors' jobs. It's about preventing repeat crisis, keeping people connected to resources, and improving overall community health across our mountain region. One of the reasons why your agencies have invested in you and this new program. Public health agencies focus on big pictures, tracking trends, identifying risk, and developing programs to improve health across entire communities. But while they look at the numbers, we as community paramedics step into those individual homes. We bring those numbers to life. In Western North Carolina, that might mean checking on someone revived with Narcan last week, visiting congestive heart failure patient living up a gravel road in Saluda, or following up with an elderly woman in Henderson County who just needs someone to make sure that she's taking her medications correctly. Public health refers to the actions society takes to ensure the health of the whole community. It's an organized effort to promote, protect, and preserve health on a large scale. But here in Western North Carolina, geography and the access make this a very real challenge. Our health departments can track overdose spikes or chronic illness data, but we as CPs are the ones on the ground, seeing firsthand what's happening in homes, neighborhoods, as well as the surrounding communities. Community health focuses on defined groups, whether that's the elderly in Polk County, our farming families in Transylvania, or unhoused populations in Asheville. The CP's role is to improve health by visiting these patients, offering education, and connecting them to health care. For example, a frequent 911 caller with anxiety might actually need mental health support, not just another ambulance ride. Population health is broader. It refers to people as a whole, not necessarily grouped by community. For us in our region, this means tackling region-wide problems like high rates of obesity, substance use, and diabetes. CPs help bring population health goals down to the individual level, supporting patient one-on-ones to prevent those future emergencies. We also have to be cognitive of culture sensitivity in our region. So that includes our Appalachian families who value independence, our Hispanic populations who may face language barriers, and the Eastern Band of Cherokee Indians with unique traditions. Our success as CPs depend on respecting these differences. If we come in with judgment, our patients are not going to trust us. But if we listen and respect their background, we can open the door to real change for these demographics. Personal health comes down to individual choices, their diet, seat belts, seeing a doctor, but access isn't equal for everyone. We might help a patient by encouraging exercise, guiding those food choices, or setting up regular blood checks or blood pressure checks at home. These small interventions really can keep people healthier and reduce our repeat 911 calls. It's about those little changes, those baby steps that lead up to the big ultimate change. Community paramedics also directly support personal health activities. For example, we might check a child's car seat at a DSS event or help a family implement a food plan. In our area, we often see grandparents raising grandchildren. Our role might be teaching safe sleep practices or making sure that our medications or guns are actually locked up in our households. Public health activities focus on protecting large groups of people. Examples include keeping water supplies safe, maintaining accurate health records, and participating in vaccination drives. CPs and WNC can contribute by volunteering at flu clinics, helping our health departments identify overdose clusters, and reinforcing safe well water practices in our rural communities. Physical factors also matter. In our area, geography is one of the biggest challenges that we have. A missed ride might mean no doctor visit at all for them, or even keeps them unable to attend their dialysis appointment. Community size also plays a role. Urban Asheville does have more resources, but smaller counties like Polk and Yancey, they rely heavy on paramedics to fill those gaps. Industrial development like plants in Rutherford County can also add new health risk. CPs help bridge these physical barriers by meeting patients where they are. Psychoeconomic factors are just as important. Many residents face poverty, limited insurance, or transportation struggles. Social norms also impact health. There's stigma around substance use and mental health, which prevents people from actually seeking care in the first place. We can break down these barriers by treating patients with respect and compassion and by connecting them with programs like VIA Health or Blue Ridge Health. In the 1970s, we learned that prevention, not just treatment, was the key to saving lives and lowering cost. Today, that prevention looks like catching hypertension early, supporting smoking cessation, and preventing overdoses before they happen. CPs put prevention into practice at that individual level. In 1977, the Center for Disease Control conducted a study that revealed that approximately 48% of all premature deaths could be traced back to a person's lifestyle or their health behavior. Contributing factors to premature mortality includes lack of exercise, unhealthy diet, smoking, uncontrolled hypertension, and inability to control stress. Then in 1979, the Healthy People Initiative outlined the issues impacting Americans' health and stress prevention. For us, prevention means visiting patients after overdoses, encouraging diabetics to monitor their blood sugar, and keeping COPD patients stable at home. These small steps save lives and reduce cost. Healthy People 2020 and now Healthy People 2030 provides national goals. The change for us is applying them locally. In our area, that means identifying where those goals overlap with our biggest issues like the substance abuse, obesity, behavioral health, and chronic illness. The MAP IT framework helps structure our work, mobilize, assess, plan, implement, and track. MAP IT. For example, we might mobilize county EMS and DSS to assist overdose hotspots, plan CP visits after Narcan deployments, implement those visits within 72 hours, and then track whether repeat overdoses happen afterwards. The National Prevention Strategy was created in 2011 to help lower health costs through prevention. Its goals line up with what we do: stop emergencies before they happen. In Western North Carolina, that means preventing readmission for CHF, reducing repeat 911 calls for overdoses or just in general, and improving the long-term patient health. These strategies focus on 4 directions and 7 priorities, including preventing drug abuse, controlling those chronic diseases. Those priorities match exactly what we see every day in the streets in our area. That's substance abuse, COPD, congestive heart failure, diabetes, and repeat EMS use. This has been around for quite a while. At the foundation of the National Prevention Strategy, their 4 strategic directions are healthy and safe community environments, clinical and community prevention services, empowered people, and elimination of health disparities. The National Prevention Strategy also has 7 targeted priorities, which are tobacco-free living, prevention of drug abuse and excessive alcohol use, healthy eating, active living, injury and violence-free living, reproductive and sexual health, mental and emotional well-being. The National Prevention Strategy also details actions that should be taken by the federal government and its partners, such as state, tribal, local, and territorial governments. That also includes employers, healthcare organizations, insurers and clinicians, educational organizations, community-based, faith-based organizations. Community paramedicine programs have a role to play in implementing the strategic directions and priorities of the National Prevention Strategies. Example could be by helping a patient with diabetes implement a food plan. A community paramedic can assist the patient in better controlling blood glucose levels and preventing damage to the patient's cardiovascular system, their kidneys, as well as their eyes. In the early 2000s, they believed that although decisions about health are primarily an individual's responsibility, society has an obligation to provide an environment in which the achievement of good health is possible as well as encouraged. Many recognize that certain segments of our population whose disease and death rates exceed the general population may require additional resources, including education, to achieve good health. Americans face several serious public health problems, including the continuing rise in healthcare costs, preventable chronic diseases, emerging and re-emerging communicable diseases, substance abuse, disasters, both natural and human-made. So in March of 2010, significant changes were made to the U.S. healthcare system when President Barack Obama signed the Affordable Care Act into law. The primary focus was to increase the number of Americans with health insurance. The ACA has succeeded in this objective. However, in providing health insurance to millions of Americans who did not have it before, the cost of healthcare insurance went up dramatically for other people. So for preventable diseases, the leading cause of death in the U.S. today are not the communicable diseases that we feared 100 years ago, but it's now chronic disease. So we have a prevalence of obesity as well as diabetes. The 4 leading causes of death in the second decade of the 21st century are heart disease, cancer, chronic lower respiratory disease, as well as stroke. Too many Americans die prematurely due to these preventable diseases. Better control of behavioral risk factors alone, such as lack of exercise, poor diet, the use of tobacco and drugs, and alcohol abuse, could prevent. So this could actually prevent between 40 to 70% of all premature deaths. That's 1/3 of all acute disabilities and 2/3 of chronic disabilities. Health disparities have been defined as a difference in health among different populations. One of the Healthy People 2020 overarching goals to eliminate disparities in our different populations, or disparities in health among our different populations. At the federal level, there are many agencies. We've got the abbreviations CDC, FDA, HRSA, CMS, NIH. Their guidelines trickle down to local practice. For CPs, it's important to know these names, but also to recognize that our daily work connects their national goals to local patients. Our public health agencies can be found at the federal, state, as well as the local level. At the national level, the Department of Health and Human Services is the primary federal public health agency in the United States. Federal public health agencies include the following: the AHRO or AHRQ, which is the Agency for Healthcare Research and Quality. The AHRQ is a research support agency. It funds, collects, and publishes research to reduce the cost of healthcare and improve its quality. The CDC, the Center for Disease Control and Prevention. So the CDC is a prevention and disease containment agency. The CDC identifies new threats to health, identifies solutions to the causes of death and disability, and helps to prevent disease through education. The FDA, Food and Drug Administration, monitors the food supply for safety and reviews and improves all medications. We have the HRSA as well that are part of these initiatives, and that stands for the Health Resource and Services Administration. Other federal public health agencies also could include, we've got CMS, Centers for Medicaid and Medicare Services. CMS oversees Medicaid as well as Medicare. We have the IHS, the Indian Health Service. They provide health care services from preventative services to treatment to Native Americans. Our National Institutes of Health, NIH, they support and perform medical research with the goal of preventing and curing diseases. 2 federal key agencies that matter directly to our particular work in our area are the SAMHSA, which stands for Substance Abuse and Mental Health Service, and ASPR as well. So the SAMHSA is the federal agency responsible for leading public health efforts around behavioral health, substance misuse prevention, treatment, and recovery. In Western North Carolina, SAMHSA's impact is seen through opioid response programs, mental health initiatives, and funding that helps local agencies support people struggling with addiction or co-occurring disorders. When we follow up with patients after an overdose, we are often connecting them to resources that exist because of SAMHSA's work. The ASPR, which stands for Administration for Strategic Preparedness and Response, well, this agency focuses on preparedness and response to public health emergencies as well as disasters. For us in Western North Carolina, that means floods, landslides, wildfires, and severe weather. That sounds very familiar. These events can isolate entire communities that we have most recently seen, and the ASPR helps ensure we have the systems and resources to respond when disasters strike, whether that's distributing medical countermeasures during a pandemic or supporting regional disaster response teams. Together, these agencies show how federal public health efforts connect directly to our everyday reality as community paramedics in the mountains. The SAMHSA supports us in tackling overdoses and behavioral health needs, while the ASPR strengthens our ability to respond when the disaster hits. Substance Abuse and Mental Health Service Administration. The goal of SAMHSA is to meet the needs of people with substance abuse issues and people with psychiatric disorders by expanding accesses to services, improving the effectiveness of preventive efforts, and facilitating rehabilitation. Office of the Assistant Secretary for Preparedness and Response, the ASPR, is that point agency that coordinates the planning for the response for public health emergencies and acts of bioterrorism, as we mentioned previously. At the state level, public health departments vary in structure, but they are central to our work. As CPs, we need to know how North Carolina organizes its health services so we can work very smoothly together with them. Locally, CPs collaborate with epidemiologists, case managers, patient advocates, and behavioral health providers. In Western North Carolina, that means working with VIA Health, RHA, Mission Health, county DSS offices, as well as others. These relationships make our work much more effective. Community paramedics can support local health departments by participating in needs assessment, delivering safety messages, and providing patient support services. In our region, that might mean helping a county health department identify overdose trends or educating families about safe heating practices in the wintertime. We often work in rural areas or clinics where we have very limited access. In Western North Carolina, some patients may live an hour or even longer from the nearest hospital. Our presence ensures that these patients will still receive basic monitoring, care, as well as education. Community paramedics can support public health initiatives in several ways, including participating in immunization clinics, delivering and administrating immunizations door-to-door in medically underserved areas, conducting new arrival visits for first-time parents, including cart seat checks or installations, home inspections and recommendations to make the home safe for children, infant and child CPR training, also conducting safe at-home visits for older adults, which could include home safety assessments, fall risk assessments, and fall prevention education, and medication inventories. For immunizations, public awareness and compliance with suggested immunization schedules, including those for influenza, as well as our pneumonia, is critical and crucial to creating that herd immunity. That is a broad-based immunity within the community that can prevent the spread of these infectious diseases to our vulnerable members of the population, such as geriatric or our newborns. Adequate immunization levels may be achieved by recruiting community paramedics to assist in the education on and administration of vaccines to vulnerable populations. So infant wellness checks, general considerations for infant wellness checks might include measurements of the baby's length, their weight, their head circumference. Wellness checks may also include noting the developmental milestones, considering their sleep pattern, verifying that immunizations are up to date. Follow-up care may also include immunization compliance, follow-up visits after a visit to the pediatric office, assessments of vital organs and well-being as necessary. Also, oral hygiene and dental care. Depending on the scope of our community paramedicine program, the community paramedic may play an important role as an educator and resource consultant for those patients who may be at risk to poor dental hygiene or have a lack of care, which is quite common in our area. The most vulnerable members of society are often at risk for dental disease due to lack of access to dental care. According to the CDC, tooth decay is one of the most common diseases of childhood. Approximately 1/3 of children aged 6 to 8 have had at least one cavity or filling, and 2/3 of those aged 16 to 19 have had some sort of tooth decay. As community paramedics, we may also advocate for such patients and assist them in obtaining access to public or low-cost dental care, provide education on oral hygiene, emphasize the importance of regular checkups, and such. Another crucial key thing is fall prevention. With our aging population, falls are one of the most common EMS calls. CPs assess for risk, encourage exercise, promote nutrition to keep patients safer as well as stronger. So our goal is to ensure that they have a safe home environment for this demographic. The community paramedic can help address this public health issue by assessing for those potential fall hazards, providing education to minimize risk, as well as they can help older adults stay independent and reduce their chance of falling by applying following strategies per local protocol. Encouraging those patients to exercise, maybe in groups, letting them know what is actually offered in our region, with a focus on increasing leg strength and improving the balance. Reviewing their prescriptions, their over-the-counter medications as well to help identify medicines that might cause side effects or interactions such as dizziness or drowsiness. Maybe even discuss the need for an eye examination and assist the patient in scheduling at least one examination each year and encourage them to update their eyeglasses as necessary. Help make patients home safer by reducing tripping hazards, adding grabbing bars where necessary, adding railings on both sides of the stairway, and ensuring the house is well lit. Educate patients on proper nutrition, including getting adequate calcium and vitamin D from their food or their supplements that they're taking. Assist patients in getting screened and, if needed, treated for osteoporosis. Also assess patients' gait and determine if there are difficulties related to ambulation that may warrant further evaluation by a physical therapist. Assistive devices should also be available if the patient is having any difficulty walking. Also, further assessment and education regarding injury prevention includes assessment of patients for cognitive impairment. Memory loss and dementia can lead to confusion, dizziness, or poor decision-making, putting the patient at risk for falls. The fall risk factors are outlined in Table 6.3 in your book as well. The plan of care created by the medical director or the patient's primary care physician will be modified based on the community paramedic's observation in the patient's home and how well the patient can navigate within their home. So it's key that you are documenting appropriately and passing this back to their point of care. Some of those obstacles to safety may be related to lack of recognition of the hazards, lack of knowledge on how to fix the hazards, lack of resources to make necessary improvements. So our role can help the older adults stay safe within the home through that education and connecting the patient with much needed resources and making sure that we are documenting what we see accurately. Home safety assessments for older adults and adults with disabilities. One concern that can be addressed by the community paramedic is the safety and wellness of the most vulnerable populations in their own homes, older adults and people with disabilities. So we may play a vital role in assessing the individual patient, the conditions that exist in their home, and reporting on their needs, as well as assisting in securing the proper resources to help protect the patient's health. Simple approaches include identifying all safety hazards in the home. That could be the fall hazards, smoke detectors, make sure they're working. Addressing activities of daily livings, or ADLs, that may be affected by the patient's physical or psychological impairment. Our home safety assessments allow us to spot hazards, space heaters, loose wiring, cluttered walkways that could lead to emergencies. In our area where many live in older homes or trailers, this is especially important. The public health department may seek the assistance of the community paramedic program to monitor the health status of patients experiencing a change in health status, either from a short-term or from a chronic medical condition. An example, some public health departments closely monitors patients with TB. A strict medication regimen is required to treat TB and prevent the transmission. Patients with TB may be at risk for medication noncompliance for economic or geographic reasons. A community paramedic could be requested to visit these patients at home daily to bring the medications to the patient and ensure medical compliance. Community paramedics may also play a role in the promotion of routine health screenings, such as those blood pressure checks, cholesterol screenings. We may be equipped with the tools and trained to perform a screening in the patient's home. We also may monitor and manage chronic diseases. So we may visit these patients who are unable or unwilling to access facility-based care. Maybe they are afraid of attending a doctor's visit because of a previous experience, or they just lack the capacity to do so. Medication compliance is something that we struggle with in our area. Some patients may find it difficult to access, understand, or even follow the physician prescribed medication plan. The problem may be notable among our older adults who are more likely taking multiple medications, or polypharmacy. The community paramedic can facilitate compliance with medication plans by educating patients on the specifics of their medications. That would be the indications, what side effects they may experience, any interactions to look out for. An example, to clarify dosing schedules, the community paramedic may set up a daily organizer and remind them of the system, remind their patient. Depending on the scope of the community paramedic program, we may also act as a liaison between our healthcare providers. That would be to integrate the patient's care or help prevent the duplication of prescriptions, which also can be a common thing. We are navigators to services. The patient-provider relationship that develops as the community paramedic visits the patient at home and identifies the patient's social and physical needs is unique in healthcare because the amount of time we spend with a patient, the number of shared experiences that you're going to have. The community paramedic may be able to convince the patient to engage with outreach services that the patient may not ordinarily agree to seek. Outreach services include many different types. In our area, could be meal delivery, transportation. These services can provide patients with the tools they need to improve their access to nutrient-dense meals, facility-based primary care, or even healthcare specialists. Outreach services can help patients on the road to self-management, better health, and thereby achieving a public health goal of healthier community members. At the end of the day, the role of the community paramedic program in Western North Carolina comes down to three pressing needs: our overdose response, those frequent EMS users, and our chronic conditions. These are the challenges we see every week in our counties, and they're the ones straining our 911 systems, our hospitals, and our communities. By addressing these issues directly through follow-up after overdoses, regular monitoring of those chronic illnesses, and helping our frequent callers find the right long-term care, we reduce unnecessary emergency calls and improve patient outcomes. This isn't about adding more work to our plates or an EMS. It's about using our skills in a smarter way that benefits both patients as well as providers. The community paramedic program is one of the most practical tools that we have to improve our health in our region. It's not flashy, but it does work. The science is there, the data is there. And in Western North Carolina, where geography and limited resources make access harder, it may be the difference between a preventable crisis and a stable, healthier patient. That's all I have for you guys today. Thanks, and holler, reach out if you guys have any questions.